Hello and welcome back to OCD Coded. My name's Erin Brown, licensed marriage and family therapist and mental health counselor. I have OCD myself, and my goal with this is to help you learn how to identify your OCD and to turn it into a superpower. So today we will be talking about sensory motor OCD, that type of OCD. And it's one that can seem like a lot of different things and gets really misdiagnosed with a bunch of other diagnoses, but that the point of it is that essentially that the person's body and the body processes that happen, like even like breathing or swallowing or a heartbeat, are feel intrusive to the person. So if I had OCD, then feeling like when you can feel your heartbeat in your ears sometimes, like when your blood pressure gets up, that's a really distressing event, or any kind of internal body signal feels like danger, or it's like, oh my gosh, what is that? And then the obsession starts, and it's like, oh my gosh, my heart's beating faster. What does that mean? Oh my gosh, so what do I need to do? I need to sit down. Okay, I tried sitting down. That didn't work. What do I do? Do I stand up? Okay, should I call? Let me take my heart rate, and that's the calculations, the da 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 da. That's how you can identify it's OCD. It's like if it feels like if I don't do something right now, something bad's about to happen. And of course, there are times when that is true, but I try really hard with my OCD to recognize that cannot be all the time. And that like and that really understanding that I to do my best I can in the moment with the information I have at the time is the thing I remind myself often. But just it's also knowing with sensory motor OCD, it's so it can be really hard to just, I mean, because it's the person's own internal processes, it becomes really difficult. Like the heartbeat feels intrusive, the breathing, swallowing, and that's also the type that can, it's called misophonia, when you really get annoyed with the sound of people chewing, or, and all of those and how connected they are to OCD because it's, again, I'm feeling like I'm whatever the stimulus is, and in this case, the person chewing is so like irritating to me. That stimulus is so irritating, and I feel like, oh my God, if I don't stop this person from chewing right now or stop hearing that noise, like something bad's going to happen. Essentially, like I'm going to crawl out of my skin is the feeling that it'll give. That it's like I've heard it said electricity or itchy, but it's just like it's I can't, it's just like this bubbling up, this feeling of crawling out of your skin is one of the closest words I have for that. And but it just, and I think about, or I was talking with one of my clients too about it with, trying to have a baby and how that would be incredibly difficult because like when you already feel like everything you feel inside your body could be a danger signal, or you're not sure what it means, or it feels intrusive in some way, that becomes really difficult to think about, that on one level at all, which was, and it really made me stop and think about it. That was something I hadn't really thought about or considered before. I don't have that type of OCD. But that just, it really made me think more about too, that misunderstanding that happens with it, where other people will think they're helping, be like, oh, it's no big deal or whatever. But how debilitating or how paralyzing, how like much trapped you feel back in a corner by it, about like it feels like I can't do the thing and I can't not do the thing. And that trapped feeling is such a big part of OCD. And then feeling like, okay, I'm trapped, I'm going to be trapped, so I need to prepare or make something, like get something ahead of time so I'll be prepared. And it's that whole push and pull between that whole thing. And with sensory motor OCD, like it's again, like even I've had a client before who had a wife who was a nurse. And so it was like, wanting her to check his vitals all the time and all of these different kinds of things. And noticing that, how like freeing it was for them to recognize when it was OCD, that you can still check your vitals if you need to. But one of the big tricks or helps with OCD is like the 10-minute rule, is thinking about like, can you do something else for 10 minutes before you do the checking or the compulsion of whatever it is, before you seek assurance, because that's a big one of those main compulsions. And with sensory motor OCD, what that would look like was, that I have some kind of internal body sensation. I mean, it could be my stomach not feeling well too. And so then I'm like, oh my gosh, my stomach's not feeling well. Does that mean I'm going to be trapped? Like, what if I have to go to the bathroom and I can't? Or, something like that. We'll get into it and get into our heads. And then it ends up causing, more anxiety and more discomfort to feeling like, and then the person leaving, the room. But the goal, so this is one of those examples where the 10-minute rule can be hard because what you're trying to learn is how to discern between what is OCD urgency and what is, no, I really have to go to the bathroom right now and I gotta go. I mean, it's not always like that, but like what it is like, no, I really need to do this thing like in this moment. I can't just wait 10 minutes like I am really having. And that's what becomes so difficult because OCD is like, but how do you know? Like, what if this is one of the times that I have to do something right now? And what if I wait 10 minutes and then the bad thing happens? And that's how that cycle just gets repeated again and again. And it's so hard, but that is the whole, or well, that's the first big piece of it is how learning how to sit in that discomfort for even just 30 seconds longer at first makes a big difference of like that if a compulsion is anything to decrease the distress of the unknown, can I practice sitting in the unknown for just a little bit longer without the obsessions and the calculations? Can I just sit in that moment and observe essentially and be able to, try to let, I try to think of it as like letting my, letting the thought or the feeling or the body sensation, like what is the message it's trying to send me? Is it trying to say I need to take a nap or I need to rest? Is it telling me I need to go, do some self-care in some way or drink some water? Like, can I listen to my body signals or even my thoughts and my feelings as just signals? And that these are all like sensory input that is coming into us, from all over, whether it's the thought, so it's an internal, thing, but the thought causes a feeling that causes a body sensation and how all of those things cascade. But that if we just practice observing them, if I can just practice observing them for a little bit longer and recognize that they don't know more than I do, like my thoughts and feelings don't know more than I do. And that just OCD is so big about being like, you're not listening. And if you don't do something right now, something bad's going to happen and it's all going to be your fault. At least that's how my OCD says it. That's how it kind of sounds. It's like, I'm going to make a decision that was wrong. That's going to hurt somebody or myself. And that like, and then it'll be my fault because I should have known better, which is the whole thing, which is no, we have to do the best we can with the information we have at the time. I have to take responsibility for my actions without taking shame and blame. But I really feel like it's important to remember with all of this how to be able to sit in that discomfort just a little bit longer. If we can be able to, be able to sit with ourselves and be able to observe our thoughts and our feelings and interpret all of this as signals, as input. And it's remembering our brain does not care if we're happy. Our brain wants to keep us alive. And our brain is not a memory storage device. Our brain is not a um, problem solver. Our brain is a signal processor. And so all of these signals that we're getting, our brain is trying to process, and that's an OCD is a processing disorder, which means it's struggling to process all of the stimulus that's coming in at one time. And that there's, evidence to show that like OCD people do take in more information from their surroundings and really have this ability to see like take in all this information, but then what makes it OCD is I take in all this information and then I struggle to process what it all means, and then I assign all these things to it that make it hard for me to, I mean, for me, like exist in the world sometimes, it's like I feel like I'm just paralyzed with fear. But that the goal of it is to know that, like, oh, again, OCD isn't, our brain is a signal processor. And so when my OCD is struggling to process one of the signals, can I practice not obsessing about that signal? Can I just try to be the observer? Can I say, okay, I'm going to just observe this signal. I'm going to think what this signal is trying to tell me, and I'm not going to like attach this shame and blame to it, that like this can just be a signal. It's not good or bad. And like to think of it like thirst, like if I'm thirsty, I drink water. And so like that is a signal, that thirst is an internal signal that again with sensory motor OCD is really difficult. Like any of those internal signals, anytime you get a signal from your body and something shifts in your body, to feel like that was so intrusive and like how exhausting that would be, and how we're just like, that the practice of that is we're going to sit and observe. We're going to sit in that unknown just for a minute. We're going to recognize that our brain is trying to process signals. And can we look at these signals in a different way? Can I accept my first thought about it, like, okay, you know, oh my gosh, this is happening. I think I'm having, this really bad thing happen. And then be like, okay, that's one option. What are some other options about this, what this can be? And just giving myself the space to move to the next step, because that's what OCD does so hard of. It's like it really just zeroes in on this one part that can we say, okay, yes, maybe, maybe not. But then either decide like soothe myself or take an action. But those are the only things we can do. The obsessing is not going anywhere, that it makes it think that it's helping. It gives us that dopamine hit from worrying. And so we keep thinking that, oh, this is actually doing something, but it's not. And so it's that dance with our OCD where we're saying, that I thank you for, trying to help, but it's not helping. And that how with sensory motor OCD, that can be really difficult because like that's why that one is so hard because it's like, well, what if this is a heart attack? Like, what if this that my heart beating faster means I'm going to have a heart attack. I do need to do something right now. And so that one it becomes so difficult and it really needs um just but like the love and the patience, and that's where that shadow work comes in, is like first we have to accept that this is part of us, that this sensory motor OCD is going to be part of us and it's going to be there, and the more I fight against that also the harder it's going to be, but that I just learn to respond to it differently, that's what it keeps coming back to, is how do I respond to this differently, how do I practice responding to it in a different way, how do I think of another option, how do I transform my mind. And I like to think of it as a challenge, and that helps me to get to do it when I have a hard time. But just being like, okay, I can, yes, Aaron, that is one possibility of why that person, left you out of that thing or whatever it is, or, but there's also lots of other possibilities about what it could be. And that's one of the ways that I work with that. Maybe, maybe not, and try to extend that. But with the sensory motor OCD, it becomes the goal would be to practice just as long as possible, sitting in the unknown and trying to be the observer of those signals before jumping to conclusions. And that's that whole part too. If we want to build trust in yourself, that you'll know, that you will know. And OCD really makes it hard to believe that we can trust ourselves. And we're like, we don't know, how will we know? But that, like, again, that difference between that anxiety feeling of what that feels like and what a danger signal is from within our body, and being able to determine the difference between the safe feeling and not. So we will go into that more next time. And I hope you all have a great week practicing this, and let me know what your thoughts are, and I will see you next week.